Good morning, Dan and Amy. Well, Amy is a little bit under the weather. Maybe she's at YourChoice Direct Care getting some primary care for her cold. We were talking to C. Stephen Tucker from healthinsurancementors.com at the top of the hour about a number of things related to the Republican Party's failure to replace Obamacare and its impact on the individual health insurance market. I wonder if this is good news for concierge medical services providers like YourChoice Direct Care, like the Oklahoma Surgery Center that we've spoken about before on this show, where you actually have something you don't normally get when you've got either a health insurance company or the government as your middleman between your provider and you. Actual prices for that you can comparison shop based upon, prices for services, prices for membership. Will the failure of Obamacare and the failure of the Republican Party to replace Obamacare with something that does a better job of connecting consumer to provider be a boon to concierge service providers? Well, why don't we ask one? He is Dr. Chad Savage, and he is the founder of YourChoice Direct Care. Dr. Savage, thanks so much for joining us. Appreciate it.
Yeah. Thanks for having me on the show today. And I would just say that had Amy come here, she would clearly be back to work already.
Of course, and she'd be financially better for the experience. I mean, I'm looking at your website, which is YourChoiceDirectCare.com. Membership rates, if you're 0 to 39 years old, $39 a month, 40 to 59, $49 a month, 60 to 69, 59, age 70 over $69 a month. And then you've got prices for other things too. It's like it's $12 to get a flu shot and this and that. Give us a sense of what, in terms of the primary care services you provide, the cost of those quality services versus if I'm going to my doctor through Blue Cross Blue Shield, or I'm on Medicare, or I'm on Medicaid. Did you have a sense of the market compare in terms of out of pocket?
Oh, absolutely. And it's not even close, ironically. A lot of times in the healthcare system today, the costs are actually kind of hidden. You hide it through deferred wages for insurance plans or other ways. So $39 is for unlimited visits. So if someone sees us today, that month is $39. If they see us next week, it's still the $39 that they paid for the month. There's no copays. There's nothing. It's unlimited visits at that rate at that age. And then we try to make it even more cost-effective by throwing in wholesale prices on labs, imaging, and medications, and a lot, because we recognize that though the ideal is the patient controls those dollars and spends them as they see fit without all the middlemen involved in the system, sometimes today people get plans through their employer that maybe theoretically pay for primary care services, so we try to decrease the aggregate spend of that patient. Meaning, if they're going to spend $50 on a med, that we can get them for $4, they just saved more than the cost of the membership on the medicine alone. So we effectively made ourselves free, and they threw in their doctor for free.
Well, and it seems to me you're the rare doctor who has a clear understanding of Econ 101. Things like $1 today is worth more than $1 tomorrow. 2 months free per year for patients who pay annually. 1 month free for patients who pay quarterly. 10% off for spouses. It's a volume game. So this is, you're running this like a business, but that's kind of what it's supposed to be, isn't it?
Yeah, absolutely. The hope is that as this takes root, and I will say there's a growing number of doctors who are doing what we are doing, and I'm actually not the originator of the concept. Dr. Josh Umber down at Atlas MD in Wichita is probably the originator of the model I'm doing, and there's a Dr. Jill Green, I believe it's MedLogic in the Chicago area, is doing something similar. As more and more doctors do this, I actually think it'll get to the crux of the problem, which is fixing the prices in medicine. The prices in medicine are so incredibly out of whack that the only way you can sustain them is to subsidize them, which seems to be each fix that is proposed for health care is just talking about, well, you need to make it affordable by subsidizing it further. But all that does is perpetuate the false pricing structure.
Right.
We need to get competition into the system.
Right. I don't know. I don't understand why. So we subsidize college tuition, and that's the thing that has outpaced everything over the last 30 years in terms of price. So what you subsidize, you get more of. So you say you're extending this kind of Byzantine pricing system that is frankly unknowable. This is Steve Forbes' great formulation on healthcare, right? It's the one business where nobody knows what the prices are, and when you have an increased demand, they call that a crisis. Yeah, I mean, it's just odd. I'm looking at the cost for testing too. I mean, MRI tests as low as $275, X-rays $37. When I've had to go in and get those, if I look at, to the extent I can decipher my bill from my health insurance provider, I mean, it's five to seven times those prices.
Yeah, and there needs to be a corrective signal, and prices are that corrective signal. And when people, have transparency of prices and control those dollars, they behave as consumers, and just like they do in every other industry. But that does not occur to a large extent in healthcare, and that's why we get these totally fabricated, prices. And again, if it's hidden, people kind of stop looking. They go, "Oh, it's the bill I just saw, it said $5,000. Who cares? It was paid for by my insurance."
Right.
But what they don't think about is the reason their premiums are astronomical is because these false prices are perpetuated through the system.
Right.
So we believe that if doctors, providers, laboratories, and everybody else start competing with each other, and for example, I have a certain price, and in medicine, everything's very fixed. There's actually a committee called the Relative Value Committee that sets the prices across the entire United States, basically. It's a 31-member panel that sets the prices. They send them to CMS and the government. The Medicare largely rubber stamps those prices, and then every insurance company bases their reimbursement rates based on a percentage above the Medicare rate. So when you think about that, if you actually connect all those dots, it means it's very centrally controlled. A 31-member panel essentially sets the prices for services across the United States. That's why they don't vary much, at least from doctor's office visit to doctor office visit. And what that means is you've eliminated the normal market signals for competition. So, if Joe down the street is a doctor who's giving a better price than I'm giving, I either have to lower my price or give a higher quality of service. Either way, it's good for the patient, and that is not existent largely in the system today.
Well, right, and I mean, why would price controls work any better in healthcare than they work for any other good or services? So I suppose my question then is, we know how this is for you, and this is why you started this business. What about the market feedback you're getting from your patients in terms of their experience doing this versus doing the traditional third-party payer?
Oh, we've been very blessed. I do have to quickly say that we are not an insurance company, so we do still encourage people to have coverage options of some sort, either a very inexpensive, high-deductible catastrophic plan, or there's something called Christian health sharing,
right?
Like Liberty and MediShare and the others, and you may be aware of those. And those are coverage options that are usually a third the cost of normal insurance. But anyway, if they do that right, and they link us with our good prices to an inexpensive coverage option, they can literally save thousands. They're thrilled. They're getting better care, same-day accessibility, 30-minute to 1-hour visits. And by having that same-day accessibility, by having smaller patient panels, people can get in to see us and in many situations avoid going to the ER. I mean, not in all situations. If they're having a stroke, they should still go immediately to the ER. That is a catastrophe. That is when catastrophe insurance or catastrophic insurance should kick in. But for routine things, why do you have a trauma team sitting around on standby with crash carts and trauma surgeons at the ER waiting for somebody to come in with a cold? It's an incredibly inefficient use of your resources. They want us, in the primary care community, a doctor and a nurse, to have extra capability to accommodate those peoples. And that's what hopefully we accomplish.
Over at margarinerevolution.com, which is a blog run by a couple of economists at George Mason, Alex Tabarrok makes the point that we should talk a little bit about the supply side of healthcare in this country, too. He talks about investing in more spend on medical research for intractable diseases, demand for price transparency from hospitals, which you've been talking about a little bit. He also mentions increase the supply of physicians despite an aging population and greater demand. The number of MDs per person has been trending downwards. Well, I suppose part of that is because maybe they don't enjoy the oligopolist oligopolistic marketplace in which they're operating now, and maybe providers like your business will encourage more people back into the medical field.
Yeah, that's the hope. I mean, not only do you have a decreasing number of doctors, given the aging population, but the bureaucracy's actually made them less efficient. They've shown in recent years the average doctor has been able to accommodate 20% fewer patients than they did between 2010 and 2014. And if you think about that, what that means is that added bureaucratic waste of productivity of the doctors is essentially an entire day a week gone, lost to that doctor being able to produce, that instead is now redirected to bureaucratic activities like clicking buttons on a computer screen to make sure we get the payments and to be data entry clerks. And if this is a limited resource, and one of the great values in the medical system is the limited time resource of the doctor, this is an incredible misuse of that precious time resource that should be focused on the patients.
So your experience with YourChoice Direct Care, your business, both with your colleagues and with your patients, is that you guys enjoy doing, getting more time to do what you do, which is to treat your patients. The patients get more kind of individualized attention at a lower cost, and kind of everybody enjoys the experience a lot more, and it's a better model for you as a medical professional.
No, undoubtedly. And I mean, some of the things that you just don't even realize until I made the shift about 2 years ago. And I was very blessed to do it. And I was, I'm into my 40s, and I had been doing this for about, 13, 14 years when I made the switch. And I just found that the quality of care diminished just immeasurably. We weren't making eye contact with our patients. We were rushing in, rushing out. And we always tried to focus and give them as best care as possible, but our attention was so split and our time was so limited that in 5, 6, 7-minute visits, it was impossible to offer the care and compassion. And even though we're trained to say things like, do you have any other questions, before leaving, when I was in the insurance model, we were so immensely overworked that in the physician's head, you're going, oh, please, don't say there's anything more, because you had to run to the next room. But what's beautiful in this model is we're offered enough time by having a more limited patient census and actually making it cheaper for those patients, that when we have 30 minutes to an hour to dedicate to each of our patients, and we ask them if they have any more questions, we actually mean it. And I don't have shivers go up my spine when they say yes. I go, okay, great. Well, how do we solve these problems for you? And it's a blessing. So you asked, was it rewarding? It's actually restored my faith in the practice of medicine, which is the whole reason I did it.
Yeah, right.
I mean, you got to think about it. Your middle career, I was very blessed. I had a burgeoning, very busy insurance-based practice. It was financially very successful for me. Why would I throw that away? And it's because I thought, despite its financial reward, the practice of medicine had become untenable. And I just couldn't do that. I didn't go into primary care. I mean, don't get me wrong, everybody likes to make a good living, but I didn't go into primary care to become rich. I would have, done a super subspecialty if that's what I had desired to do. I did it because the promise was if you go into primary care, you get these wonderful long-term relationships, you get this, rapport with the patient, but that had been just leached out of the system because of all the bureaucracy. What I love is by eliminating the vast majority of the bureaucratic activities that we used to have to do, we have restored that sense of being a primary care doctor. I love taking care of my patients, and my patients appreciate what we're doing for them. They recognize the money we're saving them, and the fact that we give them better care. We have wonderful, happy patients. And one thing that I didn't recognize again until I made the switch was we almost never have anybody angry in our office anymore. That may sound like a weird thing to say, but in the insurance-based practice, and any doctors listening will experience this, that you have people coming in every day who you hear them yelling at your receptionist because they got a bill that they didn't understand.
Right.
It's very, very, it's a Rube Goldberg contraption, the billing systems under the insurance model. And that they have a high deductible, but they have an insurance, so they don't understand when they have a $5,000 deductible that they're paying out of pocket. They say, "How can I pay cash?" Well, if you have a $5,000 deductible, you are paying cash. You are just getting a lousy price, and sadly, they experience that. Get a $300 bill for an office visit, including EKG and other things, and they're irate about it. Well, I have insurance. I'm paying $700 a month for this insurance. What do you mean charging me $300 on top of that. And they inappropriately direct their anger towards the doctor. So we were always being yelled at for things we had no control over. So now I have patients who aren't yelling at us. I have patients who are vigorously thanking us for what we've done for them. And it's not, it's not all for them either. We enjoy it, maybe not. Again, there is a financial reward of being in the practice of medicine, but we love it because we wake up in the morning, we like coming to work again. There is immense reward in being able to care for other people. That in and of itself is incredibly rewarding.
Well, it's
all the time, and I'm
it's
sorry to ramble.
Yeah, no, it's great. It's a great story. It's a great business model. I hope it scales for you as well as for others. Dr. Chad Savage, he is the founder of YourChoice Direct Care, YourChoiceDirectCare.com. Check it out. Dr. Savage, thanks so much for joining us. Appreciate it.
Thanks so much, Dan.
And he joined us on the Turnkey.pro answer line.